Today, you ever get sick of hearing the phrase, "You don't have lines, why do you need Botox?" Hi guys, my name's Dr Sarah Tonks. I'm a cosmetic doctor in London. Today I'm going to be talking about slightly younger people who choose to have Botox. Why do they do it? What's in it for them? Maybe you don't have any lines which are there at rest, so what is the point of having a treatment like this done? There's no denying the fact that people who maybe don't have any lines in the frown lines, the forehead or the crow's feet still are getting Botox done, because I see them in the clinic all the time. So what is the point of them having it done? Why spend that money on a treatment that arguably people would say that you don't need? And often it's because of the way that it will subtly change the position of the muscles of the face. And people often like that. So often you will see that there is a raising of the eyebrow at the tail, which can give a slightly more arched look. If you're somebody who's got horizontal brows and it opens up your eye slightly, it can usually look a bit more attractive. Certainly for myself, when I started having it done, I was pretty young. I was about 26 or 27. Sounds crazy doing it at that age, but I really just like the way that it just took my eyebrow up slightly at the edge. And I didn't really get headaches beforehand, but I'd find that when I was drying my hair or putting makeup on, I'd always be constantly raising my eyebrows up like this, and I was starting to get a crease across here. So when I started having Botox done, it prevented me doing that. So it meant that that little line which was coming, I never got one there. You might have heard the term preventative Botox, and I think whilst there is an age at which this is definitely too early, so sometimes I'll get inquiries from people who are way too young, sort of in their teens, and obviously that's not appropriate to do it at that age, but I don't think there's any harm if somebody has got a fine line here when it's either at rest or they are very active with their forehead muscles. I think it's very appropriate to start doing it even at a relatively young age, should you wish to do that. So let's look at our first lady. We do have someone pretty young here. You're probably thinking, what on earth is the point of doing this? And I understand, I really do, I feel you. But you will see when you see her before and afters, there is a point, there is a purpose to this. So our lovely young lady here was starting to get the faintest of hint of horizontal forehead line, and we cannot have that, oh no. I know what you guys are thinking, that's great, what else would you do for her? Give me more information. So, kind of tricky. I'd probably do this horizontal chin crease a little. You could maybe add some filler just in front of the ear in this area here, because that will give her a bit more upwards vector. And since we're going for gold, why not just add maybe just a touch here in the lip? I'm talking like a smidge. I think that would look quite nice. You could also do a little bit in her tear trough. So let's not beat around the bush. Let's have a look at exactly what we did. So we did some Botox in the frown lines, in the crow's feet, and in the forehead. Nice and simple, very easy. Now let's rush on over to our after picture. And voila, that little pesky line there has gone. That tiny line just starting to come at the edge of the eye, we don't have. I think the real joy comes when we're looking at facial movements. Raising the eyebrows, you can see that because the muscle has now been freed up, we've got a bit more of an arch in the brow than there was before. And I know you don't walk around looking like this, but I find it a more positive vector. Now looking at the frowns, do we really need to be able to frown? She's having a really good go at frowning there. And yeah, we don't really have much of a frown going on. And storming through these, quick look at the crow's feet, you can see that they have been decreased very slightly. That's just about it. Very, very quick, very simple. Speaking about the frown line specifically, I get a lot of people who are younger working in tech who are staring at a computer screen all day, and you know they're kind of squinting at the screen. So often they'll develop either some tension in the forehead or actually a line from a very, very early age. So somebody even as young as her, who maybe is working in that field, will often come into the clinic and ask for Botox to be done to prevent that either the line from happening in the first place or because they're actually getting pain from squinting. Okay, next up, another young lady. So you can see here, actually her brows are kind of low. We don't really have much space here. And the tail is kind of low in comparison with the head of the brow. So I'm sure you guys can agree that it would be nice if we were to raise that very slightly. Sure, what else could you do? Well, I would probably add a bit of cheek filler here to even up the cheekbones. She's got this scar here. You could probably lift that up using a little bit of filler underneath. I'd probably fill the chin crease here, and why not do the middle third of the lip? I think that would look really nice on her. I don't know if it's my imagination or does she look a bit like Emma Watson? Maybe it's just in my head, I don't know. Okay, so let's have a look at exactly what we did. The old classic, the frown lines, forehead lines, and then around the eyes. Okay, so let's go straight over in a hurry to have a look at her before and afters. Not too bad. So you can see that the tail of the brow has been lifted, and now we've got a little bit more space here. Everything just looks like it's coming up slightly. Let's have a look at her frowning. So yeah, again, you can see not really much going on there. So let's have a look at her raising her eyebrows. So again, I didn't see this patient between during the procedure and the after. If I had, I probably would have dropped this brow very slightly by adding a tiny bit more Botox right there, because for me, it's just coming up ever so slightly too much. Well, that's what's so great about this treatment. You can adjust it. I think it's kind of interesting as well, the way that you can definitely see more of the eye in the after images. And lastly, let's take a look at her smiling. By doing a small injection right here and here, it helps the tail of the eyebrow come up, because this muscle around here, which gives you the crow's feet, it pulls down at the edge of the eyebrow. Next, we've got a real veteran. She's certainly been having this procedure done for some time, so really, she doesn't really have much in the way of lines and wrinkles. It's more like she's doing it to improve the position of the brow. So you can see she doesn't really have any fine lines or wrinkles at rest, but nevertheless requested Botox. So fine, we decided to go ahead and do it to prevent any potential lines and wrinkles coming up, and also to give a nice improvement in the shape of the brow. So what else could I do? It's kind of hard to say really, because this lady is not one of my regular patients, so I'm not really sure off the top of my head what she's had done previously. If I were to do anything, I'd maybe just work a little bit on her symmetry. So you can see we've got a bit more prominence of the cheek over on that side in comparison with the other. I'd maybe do a little bit of lifting here, but that's about it. Okay, so let's go over and see exactly what we did. So we did some Botox in the frown lines, in the forehead, and also in the crow's feet area. Let's see exactly what that looks like now. So there's not really a huge amount of change in the before and after. There is a bit more of an arch in the eyebrow, and often that's actually why people decide to do this treatment, because they like the way it makes their brow look after. You can see in the before picture, she actually couldn't frown too much anyway, because she's been having this treatment done for quite a while, so those muscles really are quite weak. Ditto with the forehead raising. So you can see she's not able to quite raise up as much. So let's go and have a look at her raising her eyebrows. You can see in the before picture, actually, she couldn't raise her eyebrows too much anyway, but some patients, they really, really like to have that immobility of the frontalis muscle. And lastly, let's check her out smiling. So although she doesn't really have many fine lines around the eyes, you can see the ones that she did have now gone. Okay, last but by no means least, Another young lady, I know you're going to be thinking, what the heck? Why on earth does she want to have Botox done? Well, she's been having it done for many years, and that's probably why she doesn't have those lines. Actually, that's a very good point. So people often say, why are you having that done? You don't need to have that done. You haven't got any lines. Well, duh, of course they don't have any lines, because they started having it done when they were relatively young, which means that the line can't have set into the skin, obviously. If I was going to do anything for her, what would it be? Kind of hard to improve, but I would probably do something with this chin crease. Maybe make the chin a little bit more pointed, possibly even put some Botox down there. You could further emphasize the cheekbone here. I mean, she looks pretty good anyway. Let's go over and see what we did. So we did some Botox in the frown lines, the horizontal forehead lines, and around the eyes. Taking a look at our before and after. Again, maybe not too much difference in the before and after static. You could be persuaded that the tail of the eyebrow is slightly higher than it was before. Again, she can't really move the forehead too much anyway. I often like to leave it a bit longer than this before doing an adjustment. So, you know, a lot of patients, they think that they should be having their Botox done maybe every 3 months. I prefer to leave it longer. I prefer maybe 4 or 5 month period to really let those muscles come back into action a bit. But, you know, different strokes for different folks, isn't it? Let's take a look at her frowning. You can see that she couldn't really frown too much beforehand, and now she definitely can't frown. Personally, I would have left it a little bit longer before doing it again. Everybody's different, you know. Okay guys, so that's it for this week. Join me again next week where I'm going to be talking about different ways of doing lip filler. I'll see you then.